I would suggest not to use it at all, because relationship of remedies is based on the experience of other homeopaths. The basic law is the law of similars. What matches, that will cure. Whether it is the experience of somebody else or not, it doesn't really matter. But if you find a complementary remedy to the patient, and it is also mentioned by some authority that this is good complementary, it only bolsters your confidence. That is about it. Some people do believe in intercurrent remedies, that when your remedy stops working, you need some kind of an anti-miasmatic or a no-sode remedy to push it forward. This is not often my experience. And yes, sometimes no-sodes are needed because they are indicated, not because they have to push something along. It's my experience like that. I would say, to be on the safe side, we put between 8 and 10 small, very small 10 number pills. Well, generally the state of the person is very deep and fixed, and does not change so often with external circumstances. It only gets excited or aggravated. But I believe that if there is a very, very big impact, maybe the state can change. But this I found very rarely. So normally the state remains constant, only gets excited or aggravated by very severe exciting factors. Well, it should be always the state of the whole person. You select a remedy based on the state of the whole person, in which the mental state is a part, a physical state is a part, chief complaint is a part, cravings, aversions is a part, exciting factor is a part. So always the prescription is not based on this or that, but to be able to see the presenting complaint, the exciting factor, the overall physical generals, the modalities, and the mind state as a part of the same picture. Only then your prescription will be successful. So if you have a general state of antimptart, the mind should be also antimptart, the craving should be antimptart, the physical complaint should be antimptart, then it will work. It should be a very drowsy person, wanting to be carried, especially erect, don't want anybody coming near him, thirst for sips of water, craving for apple, rattling cough without expectoration. This is the picture of antimptart. It should all be there, more or less. Then it will work. You cannot separate mind state and physical state and presenting complaint. Then you are making a confusion there. Well, bivalve is very simple. Usually the gesture will be of opening and closing, or two, right? And a shell, and no movement at all. Whereas a gastropod, like a snail or something, shows slight movements and carries its home on its own self, into which it withdraws. So these are things that come up in the case. But usually bivalve show the hand gesture of the two sides. Well, that very much depends upon the different factors. Overall, I can say that in hypothyroid the results are very good, and usually we are able to taper off the drugs completely. Second thing I want to say in thyroid is that usually the levels fluctuate a lot, so you don't have to be worried so much. Suppose it is 6, 7 TSH, not to worry. They will say normal is 4, 4.4, but 6, 7, I have seen up to 150 TSH. So it fluctuates quite a bit. So don't get very anxious about it. And depends on how sure you are of the remedy, how sure you are of the potency. And then you start treating the patient and then watching the TSH. If it is very high, for example, it is 20, 30, 40, you don't taper straight away. But if it is like 6 and 10, you can stop all the hypothyroid medicine straight away. And you can monitor very carefully, because like a high TSH for a month or two is not going to kill the patient. It's not so harmful. So you can afford 1, 2, 3 months to bring the thing back towards normal. So it's not something like in diabetes, it would be more dangerous, right? But here it wouldn't be so risky too. So if you are sure of the remedy, depends on the level of TSH, you can give your medicines, watch, and then taper slowly. I don't see any specific protocol for it. I think the question means that the patient requests us to talk to their relatives and advise them or something like, right? Right. How to handle those situations? Well, there are two factors to this. One is, often we believe that the patient has his own perception of reality. He is also looking at it from his own angle or state. And if that changes, then the behavior of the relatives and his other associates will not affect him so much. And he will be able to resolve it or deal with it in a very healthy manner. I have found, for example, that some patients say, we have so much problem at work and we feel so trapped and so persecuted and my boss is so bad. Now I can't go to the boss and tell him be good, right? But if we change the perception of the patient knows how to deal with the boss or how to get out of that organization. And this happens very, very often. Very, very often. They'll come and say, I left that job which was a problem for me. Because they stayed in the job because it matched their perception, it matched their delusion, their reality. When that reality changes, they don't want the job anymore, right? Or you can counsel the patient on how to deal with the situation. That is possible. Or you can reflect to him what he is feeling, why he is staying over there. Some awareness. Of course, in case of children, this is very difficult. Then we need to counsel the parents on how to behave. Because this changing the parent behavior is an essential part of treating the child. In which case, either they need to take treatment, they need to go for counseling, they need to change it. You cannot have a healthy child in an unhealthy home. It's very difficult, whatever you say. So in that situation, and also when we see certain sensitivities of the patient are being, you can say, propagated by the behavior of their relatives. So a woman who feels extremely neglected is actually being neglected by the husband. This is constantly exciting her state. I think it's important to make the husband aware that your this and that behavior, though it might come from any place, maybe you don't mean it or you mean it, but this and that is aggravating your wife's mental state and condition. So if you want her to be happier, you need to change these unhealthy qualities in you. Right? So that kind of counseling is definitely possible. And I think we are responsible to do that. It's our responsibility. But usually these things don't work because people don't change by telling them so. So it's often we have to strengthen our patient and change their perception, and then interestingly things change. Sometimes a woman who has severe problems with her mother-in-law, you treat her and then she says, I don't know what happened with your medicine, but my mother-in-law is behaving better. You will hear this very, very often, because often the other person's reaction to you is triggered by your own state. Right? If you go to somebody and say, Bichara, Bichara, I am so helpless, I am so... then the way they treat you, then when you go with a certain degree of confidence, hello, how are you? What kind of response you get is very different. Then you will come and say their behavior changed, which is fine. So circumstances can change if healing happens. For example, necessity to write prescriptions in some case or to give valid certifications. Well, medico-legal is something that you have to be extremely careful about, because in India, patients are very trusting, and often if you even do some things which are not fully correct, they don't really take so much action as they do in other Western countries. It is true. But still that kind of awareness is increasing, and more and more doctors are facing problems. So you have to be correct. First of all, medico-legally, you have to be correct. You have to do things within the law. Very, very important. For example, you should not give any certificates which are not correct. You cannot issue a leave certificate. You cannot issue a death certificate. You can be in severe problems. If you have taken a video recording of a case, you have to get it in writing that they give consent for specific things. You can't just do anything. You have to maintain your records very properly. You have to see that you don't do any kind of negligence. That means in your investigations, you have to be perfect. You have to refer on time. You cannot misdiagnose. For example, patient comes with cough for 2 weeks. You have to take an X-ray. You have to investigate. It could be tuberculosis, it could be cancer, it could be pneumonia, it could be anything. So you have to do your basic things. You have to examine, you have to diagnose, you have to refer, you have to be there when the patient needs you. So you have to do everything that you are supposed to do and not do anything you are not supposed to do. I had many issues about these things, and then you can land up in problems. So I don't know what else to say. So be correct, be responsible, don't be negligent, and don't issue false certificates, things like that. First of all, either the dreams are same or the dreams change in quality. That means those dreams of snakes, those terror dreams are all going down now. Now I get more routine dreams, which is good. That means the state is diluting. Or the dreams indicate something else totally different, in which case you have to change the remedy. Right? So the dreams show you three things. One is the remedy the same? Is the intensity of the state the same? And thirdly, is a new thing coming up? Well, then you have to stay with the level he is at and see what clear symptoms you get from there. And then there are many techniques by which you can go deeper, through dreams, through fears, through childhood, through interest, through hobbies, through observations, through relatives, through other, or we have got other processes through art, through music. There are many methods. It depends on the level of the patient.